Daphne's story raises a number of issues. I think one of the main things that many women have to figure out is what the best method is for them. So Stephanie mentioned the pills, the condoms, and the diaphragm. But there are other methods that are available that you don't have to remember to use every time. There are two methods that use the same contraception hormones as the pills. One is a patch, and the patch is a small patch that you apply to the skin, and it's used once a week. You use it for 3 weeks in a row and then take it off for 1 week. And the other is a ring, and that's placed in the vagina. It stays in for 3 weeks, and then you take it out for 1 week, at which point you have a period. Another thing that Stephanie thought about were side effects. The side effects of the pill and other combined methods are actually relatively few once you've been on them for a while. When you first start a method, people may have a little irregular bleeding, a little bit of nausea, but most of those are temporary. The progestin-only methods tend to have more bleeding associated with them and don't have the same bleeding control. But one of the nice things about these methods is that after you've been on them for a while, they tend to have a decreased bleeding, and eventually women have no periods at all. So one of the methods that Stephanie did try was the condom, and that's, again, a very good method because it protects against pregnancy and also sexually transmitted infections. But it's really important to know that sometimes condoms slip, sometimes they break, or sometimes a woman uses no contraception at all. And in that case, you really need to know about emergency contraception. Emergency contraception is a combination of pills. There's a dedicated product now, and you can take it immediately after unprotected intercourse and greatly reduce your risk of pregnancy. To get emergency contraception, if you're 18 or older, you can actually just go to the pharmacist and it's kept behind the counter and you don't need a prescription. However, if you're under the age of 18, you have to have a prescription. Emergency contraception works very well, especially if it's taken as soon as possible after unprotected intercourse. However, it's important to know that you can go up to 120 hours or 5 days and still have effectiveness with emergency contraception. Stephanie began her story with a pregnancy scare, and that's a very, very common story. But what she got out of that was the need to take responsibility for preventing unintended pregnancy. This is really important. But what you also hear is that not only do you have to be on a method, you have to use it correctly and consistently. That's the best way to prevent pregnancy.